Hi guys, I'm Imran Yıldırım. I'm a PhD student in obstetrics and gynecology department in Ankara University, and I'm also graduated from the English education program in Ankara University. Today I'm going to talk about clinical skills lectures and how to take samples. This is model 6 and this is about, like I said, biological sampling and taking samples from the patients. What are we taking from the animals for our diagnostic aspects? We are going to take blood, we are going to take feces, we are going to take urine, milk, we are going to do some skin scraping, and we are going to take vaginal swabs, and we are going to take some biopsy material, and we are going to talk about biopsy methods. What are we going to need before taking samples? We should take care of our health and our patients' health, most of all. And also, we should never forget about the zoonotic diseases. These diseases can infect us, and also we can transmit the diseases from animal to animal. So this is a huge risk, and we have to take care of the situation. Sampling should be done via veterinarian always. We should take the samples and send them to a lab as soon as possible. We should write the information such as dates and name and the biopsy materials types. We should wear some gloves, and if we need protective clothes, glasses, and masks. When we collect blood samples, we're gonna do we can do hematologic analysis. We can do biochemical analysis, also hormone analysis. We are gonna need needles, injectors, blood tubes, some tourniquets, equipment, alcohol, cotton, and gloves. In small animals, we mostly use the cephalic vein. And in cats, we can use the cephalous vein. And if you need, there's no available vein in arms or legs, you can use jugular vein, but it's the last resort. We commonly don't use the jugular vein in small animals. In large animals, we mostly use the jugular vein. It's different from the small animals. It's easier to use jugular vein in large animals, and also we can use the vein under the tail in large animals. There is a video that you can see the blood tubes, the different kind of blood tubes. And there's also a tourniquet. If you don't have a tourniquet material, you can ask your friend to make a tourniquet for you. So there's some different kind of canals. These are the canals, blood canals, and these are the blood tubes. The different colors means different purposes in blood taking. So I'm gonna show you. The cannules are larger than smaller in here. The purple cannule is the smallest cannule. This is placed wrong. We use the purple cannule in small cats mostly. The yellow cannule is the second one, not the pink one. The yellow cannule is the second cannule that we use. This is the most common cannule that we use in normal-sized cats. The blue cannule is the most common cannule that we use in the dogs, large dogs. And the pink cannule is bigger than the blue cannule, and the green cannule is the largest one. So these are the blood tubes that you're gonna mostly see in the clinics. We mostly use the violet one and the red one. The gray, blue, and the gold one, these are not commonly used. The violet one contains ETA, and this is a anticoagulant agent. This violet one used for hematological examination, and the red one, it contains nothing. This used for taking the serum from the blood, and this is used for the biochemical examinations. And in this video, you can see the blood taking under the tail. And also we use the same vein in laboratory animals. This is this is supposed to be a jugular vein in a large animal. You know, the skin of the large animal is very thick, so it is harder than small animals. Taking blood is harder, and also doing injections is harder. So this is a dog's arm, as you can see. If you have no one to take tourniquet for you, you can use this material. This is blocks the vein so that the blood can accumulate in the one side. So when you puncture, you can take blood easily. Or if you wanna, yeah, you can see. So this is a demonstration of a dog arm. As you can see, first you take the tourniquet. If you have no one to take tourniquet for you, you can use this material. This blocks the blood and accumulates the blood in one part of the vein. So it's easy to take blood in that vein because vein blows and you can see easily. When you puncture the skin, you can see the vein easily when you do the tourniquet. And you use cotton to stop the bleeding, and that's it. So if you're gonna do an IV catheterization, first you have to prepare the fixations. The first one is a normal bend, and the second one you just flip one side to fixate the catheter. First, again, you have to make a tourniquet to easily see the vein. And also, like I mentioned, the choosing of the catheter is very important. If you have a large dog, this is a demonstration of a large dog, you should use the blue one. In each catheter, there is a needle, and outside of the needle, it's actually plastic. So when you extract the needle, there's no pain for the animal. The needle is needed just for the beginning part. You use the needle for finding the vein, and after you find the vein, you just extract the needle, and only the plastic stays in the vein. You can also use these catheters to take blood. After that, you can administer drugs, or you can give some IV medicine to the animal. You should fixate the catheters. and that's it. And never forget to use alcohol to disinfect the arm first, because you're gonna penetrate the skin, and this can cause infections if the area is not sterile.